My name's Sarah. I've just spent an 18-week placement in Cloncurry, organised by MICRRH in Mount Isa. It was a fantastic opportunity. I got to work as a student intern for 18 weeks, working one-on-one with fantastic, highly experienced doctors who taught me a lot. It's a huge variety of cases, and it was always extremely busy, no lack of clinical experience at all. And it was really good to be able to be involved in a healthcare team rather than just tagging along for a couple of weeks. I was part of the team and able to actually help out with patient care. I found it useful as I was pushed out of my comfort zone. I couldn't hide behind other students anymore. I had to do things for myself, so I really learnt in that respect and picked up heaps of clinical skills and got a lot more confident with the kind of things that I'll have to do as an intern next year. And I just got to pick up the kind of knowledge that you do need to know for your internship. You can't learn all that practical knowledge from a textbook, and so I found it useful to kind of pick up the key facts that are really useful for a placement next year as an intern. And I really feel now that I'm quite intern ready, that it will still be a challenge obviously moving into the workforce, but that I'm a lot more comfortable with what I have to do, and I think it'll be not as big a step next year. The second thing was fantastic seeing the continuity of care in Cloncurry. Rather than just seeing patients once off in a hospital setting, I got to follow patients through and get to know them quite well, and to see outcomes of patients and how your hospital care of a patient impacts what you need to do in the GP setting and vice versa. It was also very good to see chronic disease management at its best. The practice in Cloncurry really follows best practice guidelines and does regular health checks and regular follow-ups of all chronic disease management. And it was really fantastic to see how much health can improve when things are done properly, when the time is put in, and just simple things like having an Indigenous health nurse who checks up with all the patients of how their sugars are going, how their vision's going, just so that things don't get missed. On a practical side, I got provided with fantastic accommodation and lived with other RMOs and fourth year students who came through at the time. Really well equipped accommodation, and socially it was fantastic to get to know all the staff at the GP practice and the nurses at the hospital and spend time with them, go out to dinner, and Cloncurry does have the best steak in the world, I think. So finally, I just found that it was an experience that I wouldn't have got anywhere else, and that I feel more prepared, and like I've finally been able to put the theoretical knowledge from the first 5 years into practice this year. So it was a very worthwhile experience, and it was fantastic to have the support of MICRRH to go there and get all the little logistics organised as well.